Good afternoon, everyone. Unfortunately, I couldn't make it down to Cape Town this time around, but I hope you certainly are enjoying the course and also enjoying everything Cape Town has to offer over the past few days. I'm sure you've been, bombarded with a lot of information over the last 2 days with all the didactic lectures. So I'm not going to keep you here too long this afternoon. Merely just going to share some ideas surrounding the topic of theatre efficiency with regards to surgery in general, specifically with regards to arthroplasty and a bit to knee arthroplasty as well. So I'm just going to share my screen and head over to my talk. So who is this fellow? I graduated from the University of Witwatersrand, where I did my undergrad degree. Postgrad, I did my registrar time at University of Pretoria, better known as Tux. Thereafter, I met course and I did the Tygerberg Arthroplasty Fellowship in 2019-2020. Funnily enough, and miraculously so, in the middle of the COVID pandemic, I was able to get myself down to University of Toronto in Canada at Sunnybrook Hospital, where I did an arthroplasty fellowship 2020 and 2021. I came back to South Africa in September last year. So I've been in private practice for about just under a year, slowly building up my practice. So I think the topic of theatre efficiency is certainly something that's an ongoing issue or process that I'm going through at the moment. So the big question, especially in our current economic climate, with increasing costs of healthcare, I mean, not just in South Africa, but globally, and especially in the last few years with the introduction of bundle payments. The question is, how can we keep healthcare affordable and timely accessible with better outcomes for all patients, right? And one way of doing this, in my opinion, is changing the way in which a surgeon thinks, or developing the way in which a surgeon thinks. And the first thing we want to do is treat as many patients as possible with minimum treatment effort. And the second thing we want to do, we want to treat as many patients as possible with the maximum treatment reproducibility. So we want to treat a lot of patients and we want to treat them well. But we want to do this with as little resources and effort as possible to maximize the amount of patients that we treat. And one way we can certainly do this is by standardizing our surgical process and our surgical workflow. So if we look at Henry Ford, the manufacturer of the famous vehicle, he was nothing less than what standardization is, especially to my mind. He was the inventor of efficiency. So we look at certain aspects of how he achieved that. So the first thing you need to do is to reduce the process variables. The second thing you want to do is reduce the process cost. And the third thing you want to do is improve the process outcomes, right? And efficiency in a nutshell is nothing less than these three things. So how did he actually achieve this, right? He critically evaluated all aspects of the manufacturing process. And then he looked at each step and he checked to see how each step of this process can be made more efficient, right? So if we look at the process of manufacturing a car versus a surgical procedure, it's actually not that very different. We can take each surgical step and we can try and maximize the efficiency in the way that we do it. And this is something that all of us can do as surgeons with a little bit of common sense. By critically assessing each surgical process, identifying the role players involved in that specific process, and checking out how we can improve that. Because in the end, what we want to produce or reproduce is a manufacturing process with a reproducible outcome. So we want to produce a good, stable joint replacement, and we want to be able to do it efficiently each and every time. The important thing here, and a phrase that we often hear from our older generations, is that we've always done it this way. And in order to achieve better efficiency, we have to be willing to change our old ways. And so this is a very dangerous phrase. we look at this type of thing. Just another analogy is the tenor in opera, right? Or the conductor, sorry, in the opera. The surgeon primarily remains the driver of the process of efficiency. And it's a surgeon's ability to amplify the ability of each member of your team. Just like the conductor allocates a certain task to each member of the orchestra, so too does a surgeon allocate certain procedures or responsibilities to each member of the surgical symphony to achieve the final product. So this has been a lot of, philosophical terms. The big question is, how do we implement this, right? So initially, it first comes down to education. And the first thing we want to make sure is that our surgeons are educated. The next thing that you want to do is you want to share that education or share that knowledge or ideas with our nursing team. And I put surgical rep in brackets because I know we may have people here from the UK or North America where the surgical reps don't play as much of a part in the actual surgery, but certainly in South Africa, our surgical reps do play much of a part. So we just certainly need to include them in our team. And I certainly, give a lot of responsibility to the surgical rep on my team. The second thing we need to look at is theater ergonomics. How do we rationally plan our trays? Draping is another way we can look at decreasing time and increasing efficiency. And the third thing is looking at stable retractors. So looking at surgeon education, there's various ways which we can achieve this. So one is certainly what we're doing currently right now, which is our training course. Recently now, virtual reality has become quite accessible in a lot of centers. We have cadaver courses, which is also part of this course, I'm sure. And then we have videos which are more than freely available online. And I think ultimately what's a big factor is the visiting surgeons program, as well as the reverse visiting surgeons program, which allows efficient transfer of knowledge and skills. When it comes to nursing education, you have to first get the staff buy-in, and that's the first step to carrying out any sort of change, is to share the vision with your staff and get their buy-in. And depending on where you work, they can initially be quite obstructive when introducing new concepts and techniques, because this requires a paradigm shift. So you need to accept that this may be the case. You need to evaluate the surgical process. So you need to break down each step in the surgical procedure from start to finish. So not simply just approach bone cuts, implant insertion, and closure. You need to evaluate each aspect of that surgical process and see how can we do this more efficiently. And a big part of getting staff buy-in is actually getting the ideas as to how you can actually streamline those tasks. And here again, video libraries of other more experienced surgeons and the successes they had can play an important part. Theater ergonomics is very important because what exactly is ergonomics? So ergonomics is the science of making things comfortable and efficient. And this has to do with all the interactions in the workplace, not just how you sit at your desk. And the purpose of addressing theater ergonomics is to increase the safety, comfort, and performance of the surgeon, as well as all members of the surgical team. So how can we achieve theater ergonomics in theater, right? So the first one, as we mentioned, was tray rationalization. We'll delve into each of these separately. The second one is draping, and the third one is retractors. So I'm going to use the example of the direct anterior hip just as an example. And using these same concepts, you can take it back to your specific institution, your specific workplace, and see how you can adapt to your situation, right? And because many of you may go on to adopt robotics in your surgical practice, specifically with regards to hip and knee replacements. So using these concepts, you can certainly look at how you can achieve more theater efficiency. So this is the usual site when, or the thought that goes through your mind, especially with regards to the nursing staff when they hear that you're doing a joint replacement. And just looking at this, I mean, whether you're a surgeon or you're a scrub tech or a nurse or a rep, looking at this can cause a lot of mental and physical exhaustion. It's just a lot going on here. So what exactly is the solution, right? You said you don't use most of those instruments. So number one is reduce the number of instruments. Once you reduce the number of instruments, you can better organize your trays. So this is how the standard sort of hip set would be. And this is the more conventional, more sort of recent streamlined hip sets which we've adopted. And just looking at the previous one and this one, especially with regards to the less colors, etc., it's much less exhausting. It saves a lot of time, especially with regards to packing and opening sets. And also importantly, it's less sterilization costs, because for each set that you sterilize, and very often, you sterilize whole sets and you don't actually use them, it's a massive cost to the hospital and to the health system as a whole. So how do we do this, right? So the first thing that you need to do as a surgeon and to honestly look at is, which sets do you actually use in theater? It's funny how I work with a shoulder surgeon, and we were doing some shoulder replacements, and he pulls out this massive retractor and he says, "Oh, look, I'm using your hip retractor." And I told him I've actually never seen that retractor before. Meanwhile, it's actually was in the hip sets, which they actually open every single time, which is a complete waste of time. So you need to critically evaluate what sets you use. Also look at whether you are the only surgeon using a specific set or whether you have shared sets with somebody else. Obviously, individual sets are easier to streamline. But you also need to look at, so what are you using in every case? You can't just say, they always is in the OR, and that's just the reason why we always use them. You need to see what is it in that set that you actually use, and how can you use that knowledge to streamline your manufacturing process by choosing only instruments which you use every single time, right? So this is an example of Pine's trays, or a list of instruments he uses in his trays for a direct anterior hip. And you can see it's significantly less exhausting than a typical set, right? And he knows exactly what he uses, or we know exactly what we use. We use the same thing every single time. And it makes it simpler for us. It makes it simpler for the nursing staff. It makes it simpler for the surgical scrub techs who are in theater. Things which you can look at is acetabular trials, trial liners, 28 heads. A lot of these things, we don't actually use, and you can cut them out. When you start doing robotic knee replacements, you can definitely cut out a lot of cutting blocks once you start using the robot to do most of your cuts, for sure. And then on the left is how you would typically have a full set, and on the right is, again, your streamlined set. So just looking at that again, it's just the whole visual appeal of the more streamlined, slimmer sets makes it much less exhausting for the human eye and the human mind. So by making your sets more efficient, you drastically reduce the preparation time. You have less physical exhaustion for your staff, and definitely reduce cost of sterilization. So draping is certainly a very time-consuming thing. So we look at the anterior hip. It takes about 8 to 10 minutes. You use multiple separate drapes. And then when you have multiple separate drapes and all these different steps, you have always the potential for sterility errors, right? So that's just a video demonstrating that there. And you're already on about 5 minutes, and you go on to 6 to 7 minutes after that. If you look at something like the Easy Suit, it's basically a 1-minute draping system, right? And now this Easy Suit, which we've been using for the anterior hip, and there's various generic versions locally, has now also been expanded to use for shoulders, as well as knees, as well as a posterior hip as well. So this is certainly something that you can look at with regards to making your draping more efficient. So this is just a real-time Now, after the patient has been cleaned, compared to the in excess of 6 minutes it took with the traditional draping, we look at the easy suit where we're looking at 12 seconds, 13 seconds, and just about a minute or so, surgical site should be ready to go. So not only is it time efficient, it's also much less labor intensive than your typical draping solution. So looking out and maybe looking into manufacturing your own drapes that work in such a way can drastically reduce your theater time and reduce the mental and physical exhaustion of your staff. So by using this type of drape, and I'm not, touting any specific brand, specific make, but rather the concept of an easy drape where you, instead of having 5 or 6 different parts of a drape, where you have one simple, easy to use drape, you save about 5 to 7 minutes. If you're doing maybe 4 or 5 cases a day, you're saving maybe up to 30 to 40 minutes per case. That's a significant amount of time. There's less chance of sterility errors, less time spent holding the legs up, especially when it comes to hip surgery or bigger patients. Stable retractors. In the hip, we looked at using grippers. Basically, an assistant in the box. It's single use and definitely an untiring assistant in the sense that it doesn't get tired like a human does and causes less tissue trauma. This is just an example of how they work. So you have these fixation devices on the sides of the bed. The gripper is attached to that fixation device, and then the home retractors are attached into there. And I know there are guys now who are also using this for other areas of the body other than just hip replacements as well. This is also a representation of how we can use them to actually expose the entire hip joint safely without any need for human retractors. But what happens when you don't have grippers? You can get a bit more, creative. And certainly myself and Pine both use a spider, or we use a crepe bandage wrapped underneath the contralateral leg, and that basically substitutes as a gripper. Essentially, the concept is that you want to free up your assistant's hand to help you with the surgery, not just hold retractors and then keep on slipping back and forth. You want to find ways where your retractors can work for you. So overall, the algorithm towards efficiency is that you want to increase your ergonomics and you want to increase your quality of care. Right? By increasing your ergonomics, you decrease the mental exhaustion, physical exhaustion, you decrease your hour time, and you reallocate manpower to where it's actually needed. And by this, you increase your operating theatre volume. By increasing your quality of care, you reduce the risk of inaccuracies, decrease the risk of occupational hazards, decrease surgical trauma, and increase motivation amongst your staff. And hopefully, that translates to decreased complications, increased hospital stay. And overall, when we reduce OR time, we reduce the amount of trays that we're sterilizing, we increase the economics of healthcare. So how does this translate to robotics? Is that you can have less cutting blocks, especially if you start using the robot to do most of your cuts. You can basically just literally have your trials as opposed to having to sterilize all the cutting blocks. You can open less trials if you get a better idea of what size you will need from the beginning. And you have more predictable and accurate workflow because your cuts are generally more accurate and you have less soft tissue releases than you would have in a conventional knee replacement, because you would check your gaps before you do your actual cuts. So thank you for that. I hope this made some sense, and I hope that I've planted some ideas which you can take home and implement into your theatre specifically. Thank you very much, and enjoy the rest of the course and enjoy your time in Cape Town.